Dr. Victoria Harrison froze mid-incision, the scalpel suspended above Nathan Walsh's inflamed skin as something beneath the surface moved. What should have been a routine biopsy of an itchy bump had just become a waking nightmare. "Oh my God!" the lab technician gasped, dropping her specimen tray with a metallic clatter that echoed through the suddenly silent examination room. Two nurses backed away instinctively, one bumping into a medical cart that toppled with a crash. Elizabeth Walsh, watching through the observation window with arthritic fingers pressed against the glass, recognized the look of horror on the doctor's face. The same expression she'd seen on her son's pediatrician 35 years ago when little Nathan had nearly died from meningitis. "Lock down this room now," Dr. Harrison commanded, her professional demeanor crumbling as more movement rippled beneath Nathan's skin. What hideous creature had been feeding on this man for weeks, mistaken for common bedbugs? And how many others were still hidden beneath his increasingly pallid skin? Leave a like and share your thoughts in the comments along with the city you're watching from now. Let's continue with the story. Nathan Walsh had always prided himself on self-sufficiency. At 42, he'd weathered the tech industry's boom and bust cycles, launched 2 moderately successful apps, and even survived a bitter divorce that left him with nothing but his coding skills and a mountain of legal debt. The mysterious itchy bumps that had appeared 3 weeks ago seemed like just another obstacle to overcome, certainly nothing that warranted medical attention or, God forbid, a call to his parents. His new apartment in Riverdale Heights wasn't much, a 1-bedroom unit in a converted 1970s building with questionable plumbing and thin walls. But it represented independence. The security deposit had nearly emptied his savings, but Nathan saw it as an investment in his fresh start. He'd furnished it sparsely, a second-hand oak bed frame from an estate sale, a practical desk for his programming work, and the weathered leather armchair his father had grudgingly allowed him to take after the divorce settlement left him without furniture. "You're just like your father," his mother Elizabeth had told him during their last phone call 2 months ago, her voice carrying the familiar mixture of exasperation and affection. "Too stubborn to ask for help until you're halfway in the grave." The conversation had ended with the usual awkward silence, neither apologizing for the argument surrounding his marriage to Margaret, neither willing to bridge the 3-year rift that had formed. The first bump had appeared on a Tuesday morning, an angry red welt on his forearm that Nathan dismissed as a mosquito bite. By Friday, 3 more had emerged along his shoulder blade, itching so intensely he'd torn his skin, scratching in his sleep. When a cluster formed on his neck the following week, visible above his collar, his colleague Rebecca had noticed. "Bedbug bites," she'd declared with the confidence of someone who'd battled the pests in her college dorm. Classic pattern: breakfast, lunch, and dinner. They bite in lines or clusters. The diagnosis made sense. Nathan had spent his security deposit on the apartment. He couldn't afford new furniture. The second-hand bed frame must have harbored the insects. He'd immediately ordered commercial-grade insecticide, mattress encasements, and diatomaceous earth, following every online recommendation with methodical precision. He'd laundered his limited wardrobe at the highest temperature, vacuumed every corner, and inspected the mattress seams with a flashlight night after night. Yet the bumps continued to multiply. His work performance suffered as sleepless nights left him foggy and irritable. During video calls, he positioned himself carefully to hide the increasingly visible welts. His savings dwindled further as he purchased progressively more expensive treatments. Still, he resisted calling the exterminator. Another bill he couldn't afford, another admission of failure so soon after his divorce. Each morning, Nathan stood before the bathroom mirror, counting new bumps with a growing sense of dread. They no longer appeared only at night. Sometimes he'd feel the distinctive burning itch bloom across his skin in the middle of the day. When he caught himself scratching during an important client presentation, drawing concerned glances from his team, Nathan finally acknowledged that whatever this was, he couldn't handle it alone. In his parents' day, people didn't run to doctors for every little thing. His father's voice echoed in his mind, "Toughen up, son." It's just a few bug bites. But as Nathan examined the latest cluster, angrier, larger, and somehow different from the others, he couldn't silence the whisper of fear that had begun to grow alongside the mysterious bumps. The breaking point came on a Thursday morning when Nathan woke to find his pillowcase spotted with blood. The itching had become so severe that he'd scratched himself raw in his sleep, leaving crimson smears across the white cotton. Standing in his bathroom, he twisted awkwardly to examine his back in the mirror, counting 17 new welts scattered across his shoulder blades like a constellation of misery. "This ends today," he muttered, reaching for his phone. Pride be damned. The pest control company promised to send someone that afternoon, their earliest available appointment. Nathan called in sick for the first time in 3 years, ignoring his supervisor's thinly veiled skepticism. He spent the morning obsessively cleaning, embarrassed at the thought of a stranger seeing the condition of his apartment and, worse, his skin. Gregory Reynolds arrived promptly at 2 o'clock, a stocky man in his late 50s with the weathered complexion of someone who'd spent decades in crawl spaces and attics. He carried a heavy-duty equipment case and wore an expression that suggested he'd seen it all. "Show me where you're getting the worst of it," Reynolds said after a brief introduction. "All business." Nathan led him to the bedroom, explaining his self-diagnosis and the various treatments he'd already attempted. "Sounds like you did your homework," Reynolds acknowledged, pulling on latex gloves and removing a high-powered flashlight from his case. "Let's take a look at what we're dealing with." For the next 45 minutes, Reynolds conducted a meticulous inspection of the bedroom. He examined the mattress seam by seam, dismantled the bed frame, checked behind electrical outlets, and peered into the closet corners with professional thoroughness. Occasionally, he would pause to take a sample or make a note, but his expression revealed nothing. Finally, Reynolds straightened up with a grunt, removing his gloves with a snap that seemed to echo in the quiet apartment. "Well?" Nathan asked, unable to bear the suspense any longer. Reynolds frowned, scratching his salt and pepper beard. "Mr. Walsh, I've been doing this job for 27 years. I've seen infestations that would make your skin crawl. Literally." He paused, choosing his words carefully. "But I'm not finding any evidence of bedbugs here. Not a single casing, no fecal spots, no eggs, nothing in any of the typical harborage areas." Nathan stared at him in disbelief. "That's impossible. What about these?" He rolled up his sleeve, revealing the angry cluster of welts on his forearm. Reynolds leaned closer, examining but not touching. "Those sure look like insect bites, but they're not necessarily bedbugs. Could be fleas, mites, maybe even some kind of allergic reaction. When's the last time you changed your laundry detergent?" "It's not an allergic reaction," Nathan insisted, frustration building. "I wake up with new ones every morning. They itch like hell. What else could it be?" The pest control expert sighed, the kind of sigh that suggested he'd had this conversation before. "Look, I'm not a doctor, but whatever's causing those marks, it's not bed bugs, at least not in this apartment. I'd recommend seeing a dermatologist." Nathan's heart sank. A dermatologist meant another bill, another specialist, another delay in finding relief. "You're sure? Could you have missed something?" "I could spray preventatively," Reynolds offered, his tone suggesting professional courtesy rather than necessity. "But honestly, Mr. Walsh, you'd be wasting your money. My professional opinion—" "This is a medical issue, not a pest control one." After Reynolds left, Nathan sat on the edge of his bed, staring at the disassembled frame and stripped mattress. The apartment felt emptier somehow, the silence heavier. He'd been so certain of his self-diagnosis that he hadn't considered alternatives. Now he faced a new unknown, and his health insurance, the bare minimum catastrophic plan he'd chosen to save money after the divorce, would barely cover specialist visits. His phone buzzed with a text from Rebecca. How'd it go with the bug guy? Nathan stared at the message, unsure how to respond. Admitting that the pest control expert had found nothing felt like confessing a failure, as though he couldn't even identify the enemy that was attacking him. The phone buzzed again before he could reply. A missed call notification from his mother. The third this week? Nathan swiped it away, not ready for that conversation. How could he tell her he was falling apart when he'd spent 3 years proving he could manage on his own? That night, Nathan sat at his computer, Googling his symptoms with increasing desperation. The internet offered a parade of horrors: scabies, folliculitis, papular urticaria, cutaneous larva migrans. Each possibility seemed worse than bedbugs, each treatment more complicated and expensive. Sleep came fitfully, interrupted by burning itches that seemed to migrate across his skin. In the darkness, Nathan caught himself wondering if he was imagining things. If the stress of his post-divorce life had manifested physically, his body expressing what his mind refused to acknowledge. Morning brought clarity in the form of 3 new welts on his abdomen, angrier than before, with a strange, almost translucent quality at their centers. When he pressed one gently, the pain radiated outward in a way that made him gasp. This wasn't psychosomatic. Something was wrong. He made the dermatology appointment from the office bathroom, speaking in hushed tones while colleagues washed their hands at nearby sinks. The receptionist's voice was professionally sympathetic as she explained that Dr. Victoria Harrison had an opening in 3 weeks. 3 weeks? Nathan echoed, fighting to keep his voice down. Is there anything sooner? It's getting worse. There was a pause, the sound of keyboard clicks. Dr. Harrison does have emergency hours on Wednesday mornings. If you can come in at 7:30 a.m., she might be able to see you. I can't guarantee anything, but if your condition is urgent— It is, Nathan interrupted, knowing he'd have to miss another morning of work. I'll be there. The next 6 days passed in a blur of increasing discomfort. Nathan purchased hydrocortisone cream that did nothing, antihistamines that made him drowsy without relieving the itch, and expensive natural remedies recommended in online forums. He wore long sleeves despite the warm weather, avoided the communal coffee area at work, and flinched when a colleague reached to adjust his collar, afraid they'd glimpse the spreading constellation of welts. When Wednesday finally arrived, Nathan was waiting outside the dermatology clinic 20 minutes early, having barely slept. The waiting room was mercifully empty except for an elderly woman flipping through a gardening magazine with bandaged hands. "First time seeing Dr. Harrison?" she asked, her voice carrying the slight tremor of age. Nathan nodded, trying not to scratch the newly formed bumps on his neck. "She's a good one," the woman continued. "Old school, listens before she talks. Not like these young doctors nowadays who've got one foot out the door before you've finished describing what ails you." Before Nathan could respond, a nurse appeared in the doorway. "Mr. Walsh? Dr. Harrison can see you now." The nurse, a woman in her 50s with a name tag reading Janet Parker, RN, led him to an examination room. Her movements were efficient but unhurried, her expression neutral yet somehow comforting. "I'll need you to change into this," she said, handing him a paper gown. "Dr. Harrison will want to examine all the affected areas. How long have you been experiencing these symptoms?" "About a month now," Nathan replied, taking the gown. "They started small, but they're getting worse." Nurse Parker nodded, making a note on her tablet. "And you've tried treating them yourself?" "Everything I could think of. I even had pest control come out. They didn't find anything." Something flickered across the nurse's face. Concern, perhaps, or recognition. "Dr. Harrison will be in shortly," she said, her tone softer than before. As she turned to leave, she added, "Try not to scratch them. It can lead to infection." Alone in the examination room, Nathan changed awkwardly into the paper gown, wincing as the rough material brushed against his sensitized skin. He sat on the edge of the examination table, the paper cover crinkling beneath him, and stared at the anatomical posters on the wall, detailed illustrations of skin layers and common dermatological conditions. None resembled what was happening to him. Dr. Victoria Harrison entered precisely 8 minutes later. She was younger than Nathan had expected, perhaps late 30s, with dark-rimmed glasses and a no-nonsense demeanor. She introduced herself with a firm handshake, then immediately washed her hands at the small sink, speaking over her shoulder. "Nurse Parker tells me you've been experiencing a rash for about a month, unresponsive to over-the-counter treatments. Let's take a look." The examination was thorough and methodical. Dr. Harrison documented each cluster of welts, asking precise questions about their appearance, progression, and the intensity of itching. She palpated several of the larger bumps with gloved fingers, noting Nathan's reactions. "Have you traveled recently, Mr. Walsh? Particularly to tropical or subtropical regions?" "No," Nathan replied, trying not to flinch as she examined a particularly sensitive area on his back. "I haven't left the state in over a year. Work's been too busy, and after the divorce—" He trailed off, embarrassed by the unnecessary personal detail. Dr. Harrison made a non-committal sound, continuing her examination. "Any new furniture, carpeting, or textiles in your home?" "Just a bed frame, second-hand from an estate sale. That's why I thought bedbugs." She stepped back, removing her gloves. "These lesions are certainly consistent with arthropod bites. That's insects or arachnids. However, there are some atypical features that concern me." She pointed to one of the larger welts on his forearm. "This central pallor and the surrounding erythema pattern isn't typical of bedbug bites, and the distribution across your body doesn't follow their usual feeding patterns." Nathan felt a chill that had nothing to do with the air-conditioned room. "What do you think it is?" "I'd like to perform a punch biopsy," Dr. Harrison replied, her tone professional but gentle. "It's a simple procedure where I remove a small cylinder of skin tissue for analysis. It will help us identify what we're dealing with." "Will my insurance cover that?" Nathan asked automatically, then felt foolish for prioritizing finances over his health. Dr. Harrison's expression softened slightly. "We can discuss payment options. Right now, my concern is getting you a diagnosis. These lesions are unusual, and they're clearly causing you significant distress." 20 minutes later, Nathan sat with a small bandage on his forearm, covering the site where Dr. Harrison had extracted a sample from one of the larger welts. The procedure had been quick but uncomfortable, the local anesthetic burning as it went in, the small circular blade creating a pressure sensation that made him look away. "We should have results in a few days," Dr. Harrison explained, writing a prescription. "In the meantime, I'm giving you a stronger topical corticosteroid and an oral antihistamine. If you notice any changes, fever, increased pain, lesions that appear to contain fluid or pus, call the office immediately." As Nathan prepared to leave, Nurse Parker entered with aftercare instructions. She handed him the papers with a smile that didn't quite reach her eyes. "Make sure to keep the biopsy site clean and dry," she instructed. "And Mr. Walsh, try to rest." Stress can exacerbate skin conditions. Nathan nodded, though rest seemed impossible. As he scheduled his follow-up appointment, he couldn't shake the feeling that both Dr. Harrison and Nurse Parker knew more than they were saying. That beneath their professional exteriors, they were worried. That night, alone in his apartment, Nathan found himself standing before the bathroom mirror again, examining the biopsy site. The small wound was neatly bandaged, unremarkable except for what it represented: the transformation of his problem from a personal nuisance to a medical mystery. As he turned to leave, something caught his eye: a subtle movement beneath the skin near his collarbone, like a ripple under the surface of still water. He blinked, leaning closer to the mirror. Nothing, just his imagination, fueled by exhaustion and anxiety. It had to be. The call came at 8:17 a.m., 3 days after the biopsy. Nathan was in the middle of a code review meeting, his webcam strategically positioned to hide the worst of his condition, when his phone vibrated against the desk, Dr. Harrison's office. He excused himself hastily, ignoring his supervisor's raised eyebrow, and stepped into the hallway. "Mr. Walsh?" The receptionist's voice was clipped, professional, but with an undercurrent that made Nathan's pulse quicken. "Dr. Harrison would like you to come in today, as soon as possible." "Is something wrong?" he asked, already knowing the answer. Routine results didn't merit urgent appointments. "The doctor would prefer to discuss your results in person," she replied, the evasion as telling as a direct answer. "Can you come in at noon?" The drive to the dermatology clinic passed in a blur of talk radio and racing thoughts. Nathan had slept poorly since the biopsy, waking frequently to new sensations, pinpricks of pain, phantom movements, the constant maddening itch that the prescribed cream barely touched. The welts had continued to spread, now appearing on his thighs and lower abdomen, areas previously unaffected. Most disturbing was their changing appearance. The centers had become more pronounced, almost translucent, with a strange, fluid-filled quality that didn't match any of the skin conditions he'd researched online. The clinic's waiting room was busier than during his early morning visit, filled with patients of varying ages leafing through outdated magazines. Nathan signed in, hyper-aware of the curious glances at his long sleeves despite the summer heat. He'd barely sat down when Nurse Parker appeared, bypassing several patients who had clearly been waiting longer. "Mr. Walsh," she said quietly, her expression carefully neutral. "If you could come with me, please." Instead of the examination room from his previous visit, she led him to a consultation office at the end of the hallway. The space was small but well appointed, with medical textbooks lining one wall and framed diplomas on another. Dr. Harrison was already seated behind the desk reviewing a file. She wasn't alone. A silver-haired man in his early 60s, wearing a crisp white coat with an ID badge identifying him as William Carter, M.D., infectious disease, sat in one of the chairs facing the desk. Nathan's stomach dropped. Infectious disease specialists weren't called in for bedbug bites or common skin conditions. "Mr. Walsh, please have a seat." Dr. Harrison gestured to the empty chair. "This is Dr. Carter from Memorial Hospital's Department of Infectious Disease. I've asked him to consult on your case." Nathan sank into the chair, suddenly aware of how the room's fluorescent lighting cast everyone in a sickly pallor. "My case." "What exactly did you find?" Dr. Harrison exchanged a glance with her colleague before answering. "The biopsy results were unusual. The tissue sample showed significant inflammatory infiltrate consistent with a parasitic infection, but the pathologist noted some concerning features that warranted further investigation." "Parasitic infection," Nathan repeated, the words hanging in the air like a bad odor. "You mean like worms or something?" He'd meant it as a nervous joke, but neither doctor smiled. Dr. Carter leaned forward, his manner direct but not unkind. "Mr. Walsh, I understand this must be alarming. What we're seeing appears to be a subcutaneous parasitic infestation, though the exact species hasn't been definitively identified." "How is that possible?" Nathan asked, his voice rising slightly. "I haven't traveled anywhere exotic. I haven't done anything that could—" "These organisms can be introduced through various vectors," Dr. Carter interrupted gently. "Some parasites have complex life cycles involving intermediate hosts or environmental stages. Without knowing the specific pathogen, it's difficult to determine the exact route of transmission." Nathan gripped the armrests of his chair, suddenly lightheaded. "But you can treat it, right? There's medication or something?" Another glance between the doctors. Dr. Harrison spoke first. Before we can develop a treatment plan, we need to identify exactly what we're dealing with. The initial biopsy provided limited information. We'd like to perform a more extensive tissue sampling and some additional tests. Today? Nathan asked, already rolling up his sleeve, desperate for action, for progress, for relief. Yes, Dr. Harrison confirmed. We've arranged for you to be admitted to Memorial Hospital this afternoon. Dr. Carter has facilities there better suited for the analysis we need to conduct. The room seemed to tilt slightly. Admitted? To the hospital. I can't. My job, my insurance. He trailed off, the practical concerns colliding with the growing realization that whatever was happening to him was serious enough to warrant hospitalization. Dr. Carter's expression softened. Mr. Walsh, I understand your concerns, but based on the progression of your symptoms and the preliminary findings, I strongly recommend immediate intervention. These parasitic infections can spread rapidly and potentially cause systemic complications if left untreated. Nathan stared at his hands, noticing for the first time how pale they looked, how the veins stood out against skin that seemed thinner somehow. How long would I need to stay? Initially, we're looking at 2 to 3 days for comprehensive testing and observation, Dr. Carter replied. Depending on the results and your response to initial treatments, we'll re-evaluate. Nurse Parker, who had been standing quietly by the door, stepped forward. Mr. Walsh, is there someone we should contact for you? Family or friends who could help with practical matters while you're in the hospital? The question hit Nathan like a physical blow. In the 3 years since his divorce, he'd gradually withdrawn from his social circles, burying himself in work. His parents lived 2 hours away, their relationship strained by old disagreements and stubborn pride. His ex-wife Margaret was the last person he'd reach out to. There was Rebecca from work perhaps, but they were colleagues more than friends. No, he said finally. There's no one. The admission hung in the air, adding a layer of pathos to an already grim situation. Nurse Parker's expression shifted subtly. Not pity exactly, but something more complex, a recognition of shared human vulnerability. I'll help coordinate your admission, she said softly. And Mr. Walsh, you don't have to go through this alone. The next few hours passed in a procedural haze. Forms were signed, belongings inventoried, a hospital bracelet fastened around Nathan's wrist. Dr. Carter arranged for transport to Memorial, insisting Nathan not drive himself. By mid-afternoon, he found himself in a private room on the hospital's 6th floor, changed into a standard-issue gown, an IV line inserted into his arm to deliver fluids and preemptive antibiotics. Dr. Carter returned with a team that included a younger doctor, introduced as a parasitology fellow, and 2 nurses in full protective gowns and gloves. They photographed each lesion, measured and documented their distribution, and collected blood samples for a battery of tests. We're going to perform an excisional biopsy now, Dr. Carter explained, indicating one of the larger welts on Nathan's shoulder. Unlike the punch biopsy Dr. Harrison did, we'll be removing the entire lesion. This will give us more tissue to analyze and potentially capture intact parasites for identification. The procedure was more uncomfortable than painful, the local anesthetic creating a strange pressure as the doctors worked. Nathan fixed his gaze on the ceiling tiles, counting the tiny pinholes to distract himself. 16 by 16, 256 holes in each tile. 8 tiles visible from his position. 2,048 holes. "Got it," the fellow announced, his voice muffled behind his mask. Nathan heard the metallic clink of instruments being placed in a tray, the rustle of the specimen being secured in a container. "We'll send this to the lab immediately," Dr. Carter said, applying a dressing to the site. "With luck, we'll have preliminary results by morning." After they left, Nathan lay in the hospital bed staring at the muted television mounted on the wall opposite. A local news anchor mouthed silent words beneath a weather map showing sunny skies and rising temperatures. The normality of it seemed obscene compared to the surreal turn his life had taken. His phone chimed with a text from Rebecca. "Heard you're out sick again. Everything okay?" Nathan started to type a response, then stopped. What could he possibly say? That he was in the hospital with mysterious parasites burrowing under his skin? That doctors in protective gear were cutting pieces out of him? He set the phone aside, unanswered. As evening approached, Nurse Janet Parker appeared in his doorway, no longer in her clinic uniform but still wearing her ID badge. "I thought you worked at the dermatology clinic," Nathan said, surprised. "I do. 3 days a week," she replied, stepping into the room. "I pick up shifts here at Memorial, too. Nursing shortage." She checked his IV with practiced efficiency. "How's the itching?" "The same," Nathan admitted. "Maybe worse." "It's like they know something's happening and I don't know, angry." Janet nodded, making a note in his chart. "I'll see if we can adjust your antihistamine dosage. Try to rest. Dr. Carter left orders for a mild sedative if you need it." "Thanks," Nathan said, then added impulsively, "Why did you come check on me? I'm not your patient here." Janet's eyes crinkled at the corners, suggesting a smile behind her mask. "Let's just say I have a particular interest in cases like yours. Get some rest, Mr. Walsh." Despite the sedative, Nathan slept fitfully, waking frequently to phantom sensations, tiny movements beneath his skin, pinpricks of pain that flared and subsided. The hospital sounds, distant conversations, squeaking cartwheels, the periodic beep of monitoring equipment created a disorienting backdrop to his half-dreams. Around 3 in the morning, he woke fully, his heart racing. Something was different. The itching had changed to a deep, throbbing ache centered around the biopsy site on his shoulder. He reached for the call button, then hesitated. Was this normal post-procedure pain or something more sinister? As he debated, the door to his room opened. Nurse Parker entered quietly, checking equipment with the practiced movements of someone who'd done this thousands of times. "Can't sleep?" she asked, noticing his open eyes. "The biopsy site hurts," Nathan admitted, different than before. She approached, snapping on latex gloves. "Let me take a look." Janet carefully peeled back the dressing, her expression changing almost imperceptibly as she examined the wound. "I'm going to get the resident," she said, her tone neutral, but her movements suddenly more brisk. "Try not to touch it." Left alone, Nathan fought the urge to examine the site himself. The pain was intensifying, a pulsing sensation that seemed to radiate outward. The minutes stretched endlessly until the door opened again, admitting not just Janet but also a young doctor he hadn't met before, and surprisingly Dr. Carter himself, looking rumpled as though summoned from sleep. "Mr. Walsh," Dr. Carter said, approaching the bed with purposeful strides. "Nurse Parker noticed some concerning changes at the biopsy site. I'm going to examine it now." The overhead lights were switched on, temporarily blinding Nathan. When his vision cleared, he saw all 3 medical professionals donning additional protective gear, face shields over their masks, double gloves. "What's happening?" he asked, fear clawing at his throat. Dr. Carter's voice was calm but tight. "The tissue around the excision shows signs of unusual activity. We need to take immediate samples and possibly debride the area." "Debride?" Nathan repeated, the unfamiliar medical term adding to his anxiety. "Remove potentially infected or compromised tissue," the resident explained, preparing a tray of instruments. "It's a standard procedure to prevent spread and promote healing." Before Nathan could ask further questions, Dr. Carter carefully removed the dressing. The silence that followed was more terrifying than any explanation. "Get the containment kit," Dr. Carter said to Janet, his voice steady but urgent. And page Dr. Lewis at the CDC. Tell her we have confirmation of active infestation with visible motility." Nathan strained to see what had prompted this reaction, but his position prevented a clear view. "What is it? What can you see?" Dr. Carter met his gaze, his professional demeanor intact but his eyes betraying concern. "Mr. Walsh, the biopsy site shows evidence of parasitic activity more advanced than we initially suspected. We need to perform an emergency procedure to contain the organisms and prevent further spread." As the medical team prepared, Nathan lay rigidly on the bed, his mind racing with worst-case scenarios. This wasn't supposed to happen. Parasites were something people got in tropical jungles or from undercooked exotic meats, not in suburban American apartments, not to software developers who lived ordinary, cautious lives. "I need to call my parents," he said suddenly, the words escaping before he could consider them. Janet paused in her preparations. "We can help with that after the procedure, Mr. Walsh. Right now, we need to focus on treatment." "No," Nathan insisted, a lifetime of independence crumbling in the face of primal fear. "If this is as serious as it seems, I need to talk to them now. Please." Janet glanced at Dr. Carter, who nodded almost imperceptibly. She retrieved Nathan's phone from the bedside table and placed it in his hand, then stepped back to continue preparations. Nathan stared at the screen, thumb hovering over his mother's contact. 3 years of minimal communication, of Christmas cards and perfunctory birthday calls. 3 years of proving he didn't need help, that the divorce hadn't broken him, that he was managing just fine on his own. Now, at 3:27 a.m., he was about to shatter that carefully constructed facade. He pressed the call button before he could change his mind. The phone rang 4 times, each chime stretching eternally. Then a click, and his mother's voice, thick with sleep but instantly alert. "Nathan, what's wrong?" In that moment, hearing the immediate concern in her voice, the maternal instinct that had never truly faded despite their estrangement, Nathan felt something break inside him. Not his pride exactly, but the rigid shell he'd built around his vulnerability. "Mom," he said, his voice cracking slightly, "I'm in the hospital. I need you and Dad to come." Dawn broke over Memorial Hospital with the sterile inevitability of hospital routines. Shift changes, medication rounds, the squeak of meal carts along corridors. Nathan barely noticed. The emergency procedure had lasted nearly 2 hours, a blur of local anesthetics, hushed medical terminology, and the disconcerting sensation of hands working at his shoulder. He'd been given a mild sedative that left him conscious but detached, as though watching the proceedings from a slight distance. Now, as morning light filtered through the partially drawn blinds, Nathan lay still, staring at the ceiling. The biopsy site was heavily bandaged, a dull throb replacing the strange, crawling sensations of before. An IV drip delivered a cocktail of antibiotics and antiparasitic medications, determined through educated guesswork rather than targeted treatment. The doctors had been forthright about the uncertainty. They were treating symptoms while desperately trying to identify the specific organism. A soft knock preceded Janet Parker's entrance. She looked tired, the lines around her eyes more pronounced, but she managed a reassuring smile as she checked his vitals. "Your parents called the nurses' station," she said, adjusting his IV flow. "They're on their way. Should be here by noon." Nathan nodded, a complex mix of emotions rising at the thought of seeing his parents. Relief, certainly, but also embarrassment, anxiety, the lingering remnants of old arguments. "What did you tell them?" "Just that you're stable but undergoing tests for an unusual infection," Janet replied, her tone professional but kind. "Dr. Carter will explain the details when they arrive." "And what exactly are those details?" Nathan asked, finally voicing the question that had haunted him through the night. "What did you find last night?" Janet's hands stilled momentarily. She glanced toward the door as if ensuring their privacy, then met his gaze directly. The tissue sample contained multiple viable parasitic organisms in various life stages. They appear to be a form of subcutaneous nematode, a type of roundworm, but with characteristics that don't match known species in our database. A new species? Nathan asked, the concept both fascinating and horrifying. Not necessarily new, Janet clarified, just not commonly seen in this region. Dr. Lewis from the CDC is flying in this morning to examine the samples personally. She specializes in emerging parasitic infections. The clinical terminology made it almost possible to forget they were discussing creatures living inside his body. Almost. How did this happen? How did I get... He couldn't bring himself to say worms. That's one of the questions Dr. Lewis might help answer, Janet said. For now, focus on the fact that we've identified the problem and started treatment. The excision site showed good margins, which means we likely removed the primary colony. Colony, Nathan repeated hollowly. The word conjured images of insects, of hives and nests, of organized invasion. Janet checked her watch. Dr. Carter will be doing rounds soon. Is there anything you need before I go? My laptop, Nathan said, suddenly remembering his job, his responsibilities, the normal life that seemed increasingly distant. It's at my apartment. I should email my boss, let him know I'll be out for a while. I'll see what we can arrange, Janet promised. But right now, rest is more important than work emails. After she left, Nathan reached for his phone, wincing as the movement pulled at his shoulder. There were 3 missed calls from his mother, a text from Rebecca asking if he was okay, and surprisingly, an email notification from Margaret, his ex-wife. The subject line read simply, "Heard you're unwell." Nathan stared at the notification, finger hovering over it. How would Margaret have heard about his condition? They shared no friends, maintained no contact beyond what was legally necessary during the divorce proceedings. Curiosity won out, and he opened the email. Nathan, a mutual acquaintance, mentioned you're having health issues. I know we didn't part on the best terms, but I wanted to reach out. If there's anything you need, please don't hesitate to ask. Take care, Margaret. The message was polite, impersonal, exactly what one might send to a distant colleague. Yet something about it nagged at him. The timing, perhaps, or the vague reference to a mutual acquaintance. Before he could analyze it further, Dr. Carter entered the room, accompanied by the young resident from the night before and a woman Nathan hadn't met, her CDC credentials prominently displayed on her lab coat. "Mr. Walsh, good morning, Doctor," Carter said, his voice carrying the controlled energy of someone who'd had too little sleep and too much coffee. "This is Dr. Amanda Lewis from the Centers for Disease Control. She's here to consult on your case." Dr. Lewis was perhaps mid-40s, with short-cropped gray hair and intelligent eyes that assessed Nathan with clinical precision. "Mr. Walsh," she greeted him with a nod. "I've reviewed your case file and examined the specimens collected last night. I'd like to ask you some additional questions, if you feel up to it." "Of course," Nathan replied, straightening slightly against his pillows, instinctively wanting to appear stronger than he felt. What followed was a detailed interrogation about his recent history, places he'd visited, foods he'd eaten, people he'd been in close contact with, items he'd purchased. Dr. Lewis paid particular attention to his second-hand furniture. "The bed frame," she said, making notes on a tablet. "You mentioned it came from an estate sale. Do you recall anything about the previous owner?" Nathan frowned, trying to remember details from a purchase made months ago. "Not much. It was handled by an estate company. The owner had passed away, I think. Elderly woman, if I remember correctly." "Any indication the previous owner had traveled internationally?" Dr. Lewis pressed. I don't know. I didn't ask." Nathan paused, a memory surfacing. Wait, there was something. The guy running the sale mentioned she had quite the collection of souvenirs. There were these carved wooden figures, I think from South America. That's why I noticed the bed frame. It had similar carvings on the headboard. Dr. Lewis and Dr. Carter exchanged glances. Imported wooden items, particularly those with bark still attached or untreated wood, can sometimes harbor organisms, Dr. Lewis explained. It's one possible vector we're considering. So this came from my bed? Nathan asked, the irony not lost on him. He'd been right about the bed all along, just wrong about the specific threat. It's a working theory, Dr. Carter cautioned. We're still trying to identify the exact species and confirm the transmission route. As they continued their examination, Nathan's thoughts drifted to his apartment, to the wooden bed frame still assembled in his bedroom. Had it been harboring these creatures all along, waiting for the right moment to transfer to a new host? The idea was straight out of a horror movie. The treatment, he said, interrupting a technical exchange between the doctors. Is it working? The medication you're giving me? Dr. Carter's expression was carefully neutral. The broad-spectrum anti-parasitic should be effective against most nematode species. We're monitoring your blood work and will adjust as needed based on Dr. Lewis's identification. It wasn't exactly a yes, Nathan noted. Before he could push for clarification, a nurse appeared in the doorway. Dr. Carter, Mr. Walsh's parents have arrived. They're at the nurse's station asking to see him. A wave of anticipation and anxiety washed over Nathan. 3 years since he'd seen his father in person, nearly a year since his last brief visit with his mother. The thought of them seeing him like this, weakened, dependent, his body invaded by parasites, filled him with a complex shame. Send them in, Dr. Carter instructed, then turned to Nathan. Would you prefer we explain your condition, or would you rather have privacy first? You explain, Nathan decided, suddenly exhausted by the prospect of finding the right words. They'll have questions I can't answer. Minutes later, Elizabeth and William Walsh entered the room, their expressions a mixture of concern and trepidation. His mother looked older than he remembered, her once auburn hair now fully gray, her posture slightly stooped. His father stood straight as ever, military bearing intact despite his 78 years, but his face was deeply lined, his eyes clouded with cataracts that hadn't been there during their last meeting. Nathan, his mother breathed, rushing to his bedside, hands fluttering as if unsure whether to touch him. Oh, my boy. Hi, Mom, Nathan managed, his throat suddenly tight. Dad? William Walsh nodded, his expression unreadable as he took in the medical equipment, the bandages, his son's pallid complexion. Son. Dr. Carter introduced himself and Dr. Lewis, then explained Nathan's condition in carefully measured terms. A parasitic infection of unknown origin, treatment underway, prognosis cautiously optimistic pending further identification. Nathan watched his parents' faces as they absorbed the information, saw his mother's hand creep into his father's, their fingers interlacing in a gesture so familiar it made his chest ache. Is it contagious? His father asked, practical as always. No evidence of person-to-person transmission, Dr. Lewis assured them. The parasite requires specific conditions to complete its life cycle. And how long will he need to stay? His mother inquired, her free hand now resting lightly on Nathan's arm, careful to avoid the IV line. At least through the weekend, Dr. Carter replied. Possibly longer, depending on how he responds to treatment. The conversation continued, medical details mixed with practical considerations, insurance questions, work notifications, apartment maintenance. Throughout, Nathan remained largely silent, observing the strange tableau of his estranged parents advocating for him, organizing his affairs, stepping effortlessly back into roles they'd occupied during his childhood illnesses. When the doctors finally left, promising to return with updates later, an awkward silence fell over the room. Nathan's father moved to the window, looking out at the hospital parking lot with studied concentration. His mother adjusted the thin blanket covering Nathan's legs, smoothing imaginary wrinkles. "You didn't have to come," Nathan said finally, the words emerging more harshly than intended. His mother's hands stilled. "Of course we did. I know things have been difficult," she continued when Nathan didn't respond. "But we're still your parents, Nathan. Nothing changes that." 3 years, Nathan said quietly. 3 years of barely speaking, and now you're here acting like nothing happened. His father turned from the window, expression tight. "You think we wanted it this way? You cut us off, Nathan. Every attempt to reach out, you pushed away." "Because you never accepted Margaret," Nathan shot back, old wounds reopening. "From day one, you decided she wasn't good enough." "We only wanted you to be careful," his mother interjected, distress evident in her voice. "To be sure. Marriage is—" "I know what marriage is," Nathan interrupted bitterly. "I also know what divorce is. Intimately." William Walsh's jaw tightened, but something shifted in his eyes, not softening exactly, but a recognition of shared pain. "We were wrong," he said finally, the admission clearly costing him. "Not about her, time proved us right there, but about how we handled it. We should have supported your decision even if we had concerns." The acknowledgement, so long in coming, momentarily robbed Nathan of response. His father had never been a man who admitted mistakes easily. "I'm sorry, too," Nathan said eventually, the words feeling strange on his tongue after years of stubborn silence. "I should have called, should have let you know I was struggling." His mother's eyes filled with tears. "Are you struggling?" Nathan looked around the hospital room, at the IV in his arm, the monitors tracking his vital signs, the biohazard containers holding specimens of parasites extracted from his body. A laugh escaped him, tinged with hysteria. "You could say that." The moment broke the tension, his mother's worried chuckle joining his, even his father's mouth twitching slightly. It wasn't forgiveness, not yet. Too many words remained unspoken, too many hurts unaddressed. But it was a beginning, a crack in the wall they'd built between them. "We'll figure this out," his mother promised, squeezing his hand. "Whatever these things are, we'll get through it. Together." Nathan wanted to believe her. But as afternoon faded into evening, bringing more tests, more consultations, more carefully neutral medical assessments, doubt crept in. The itching had returned, different now, deeper, more insistent, spreading to new areas despite the medications flowing into his veins. When he mentioned it to the evening nurse, her concerned expression and immediate page to the resident on call only confirmed his growing fear. Something was still alive inside him, still moving, still feeding, and the doctors, for all their expertise and technology, didn't know how to stop it. That night, lying in the semi-darkness of his hospital room, listening to the muted sounds of the medical ward, Nathan found himself doing something he hadn't done since childhood. He prayed, not to any specific deity, but to whatever might be listening, whatever might grant him the strength to face what was coming. Because despite the reassurances, despite the treatments, despite his parents sleeping uncomfortably in the waiting room down the hall, Nathan knew with inexplicable certainty that this battle was just beginning, and somewhere beneath his skin, the enemy was regrouping. Morning rounds brought a flurry of activity to Nathan's room. Dr. Carter arrived with Dr. Lewis and 2 residents, their expressions grave as they examined the new lesions that had appeared overnight, angry red welts along Nathan's rib cage and lower back, areas previously unaffected. The anti-parasitic medication, powerful enough to cause nausea and headaches as side effects, seemed to have barely slowed the infestation's spread. "We need to adjust your treatment protocol," Dr. Carter explained, reviewing the latest blood work results on his tablet. "Your eosinophil count is still elevated, indicating ongoing parasitic activity." "In English, please," William Walsh interjected from his position by the window. He'd barely left the room since arriving the previous day, sending Elizabeth to the cafeteria or hotel for rest while he maintained a stoic vigil. Dr. Lewis took over, her CDC training evident in her clear, measured explanation. Eosinophils are white blood cells that increase during parasitic infections. Nathan's levels suggest the parasites are still active despite our initial treatments. We're going to try a combination therapy approach, multiple medications targeting different aspects of the parasite's biology. "And if that doesn't work?" Nathan asked, voicing the question hanging in the air. A weighted silence followed. "Let's focus on this next step," Dr. Carter suggested, avoiding a direct answer. "The new medications will be more aggressive with potentially stronger side effects. We'll monitor you closely." After the doctors left, Nathan's father remained by the window, his military posture betrayed only by the slight slump of his shoulders. "They're not telling us everything," he said quietly. "Dad," Nathan began, but his father cut him off with a raised hand. "I recognize that look, son. Saw it in field medics in Vietnam when they didn't want to tell a soldier how bad his wounds really were." William turned from the window, his weathered face set in determined lines. "I'm going to speak with that CDC doctor alone, get some straight answers." Before Nathan could respond, Janet Parker entered with the first dose of the new medication regimen. She worked efficiently, changing IV bags and adjusting flow rates, her movements practiced and precise. "How are you feeling this morning?" she asked, her voice pitched low, almost intimate. "Like I'm hosting an unwanted party under my skin," Nathan replied, attempting humor that fell flat against the reality of his situation. "The itching's worse, and there's a new sensation, like electrical pulses running along my nerves." Janet's expression remained professionally neutral, but something flickered in her eyes. Recognition, perhaps, or concern. "I'll note that in your chart, Doctor." "Carter ordered additional pain management if you need it." "Thanks," Nathan said, then impulsively, "Why are you so invested in my case? You're working double shifts between here and the dermatology clinic. Don't tell me it's just the nursing shortage." Janet's hands stilled momentarily. She glanced at William, who had stepped into the hallway to speak with a passing doctor, then back to Nathan. "My husband had something similar," she said finally, her voice barely above a whisper. "Last year, he was a wildlife photographer, spent 3 months in Central America documenting bird migrations. When he came home, he had what looked like insect bites." Nathan felt a chill that had nothing to do with the hospital's aggressive air conditioning. "What happened?" By the time they identified the parasite, it had spread to his central nervous system. Janet's professional demeanor cracked slightly, revealing a glimpse of profound loss. "The treatments came too late." "I'm sorry," Nathan managed, the words inadequate against the weight of her revelation. Janet straightened, composure returning like a protective shield. "Your case is different. We identified it earlier, and Dr. Lewis has resources my husband's doctors didn't. She paused, seeming to choose her words carefully. "I just want to make sure history doesn't repeat itself." Before Nathan could respond, his father returned, accompanied by Dr. Lewis. The CDC specialist carried a tablet showing images that Nathan couldn't see from his position in the bed, but his father's expression, a mixture of shock and grim determination, spoke volumes. "Mr. Walsh," Dr. Lewis addressed Nathan directly, her tone more urgent than before. "We've received preliminary genetic sequencing results from the specimens we collected. The parasite appears to be a previously undocumented variant of Dirofilaria, a genus typically found in tropical regions." "What does that mean for treatment?" Nathan asked, trying to focus on practical implications rather than the horror of having an unknown species living inside him. "We're consulting with tropical disease specialists and parasitologists worldwide," Dr. Lewis explained. "In the meantime, we'd like your permission to try a more aggressive approach, a combination of powerful anti-parasitic medications coupled with localized treatment of the most active sites." "Localized treatment?" Nathan repeated, sensing there was more to this clinical terminology. Dr. Lewis exchanged glances with William Walsh, something unspoken passing between them. "Surgical debridement of the affected tissue," she clarified. "Essentially, removing the most heavily infested areas to prevent further spread, particularly toward vital organs or the central nervous system." The room seemed to tilt slightly as the implications sank in. They were talking about cutting pieces out of him, carving away parts of his body where the parasites had established themselves. Nathan closed his eyes, fighting a wave of nausea. "Do it," he said finally, opening his eyes to meet Dr. Lewis's steady gaze. "Whatever gives me the best chance." "There's one more thing," Dr. Lewis added, her tone shifting subtly. "We need to investigate the source of your infection more thoroughly. With your permission, we'd like to send a team to your apartment to examine the bed frame you mentioned and check for other potential vectors." Nathan nodded his agreement, then remembered something. "My neighbor has a key, Frank Miller in 4B. He's usually home, retired military, keeps an eye on the place when I'm away." "Doctor." Lewis made a note on her tablet. "We'll arrange that today. The sooner we identify the source, the better we can understand the parasite's life cycle and potential vulnerabilities." After Dr. Lewis departed, William Walsh pulled a chair closer to his son's bedside, sitting for the first time since arriving at the hospital. "That doctor showed me the images," he said without preamble, "of these things inside you." Nathan wasn't sure he wanted to know, but found himself asking anyway. "What did they look like?" His father's expression darkened. "Like nothing I've ever seen. And, son, I've seen plenty in my days as a medic." He leaned forward, resting his weathered hands on the edge of the bed. "But we're going to beat this. You understand me. Whatever it takes." The conviction in his father's voice was almost enough to make Nathan believe him. Almost. That afternoon, Elizabeth returned from the hotel where she'd gone to shower and change, carrying a small duffel bag of essentials for Nathan. His own toothbrush, a comfortable t-shirt to wear under the hospital gown, the paperback mystery he'd been reading before all this began, small comforts that somehow made the sterile hospital room slightly more bearable. "I called Rebecca from your office," she mentioned as she arranged his things in the small bedside cabinet. "Lovely girl. She's taking notes for you in meetings and keeping your supervisor updated. Said to tell you not to worry about work, just focus on getting better." Nathan felt a pang of gratitude mixed with embarrassment. Rebecca was going above and beyond colleague duties, yet he'd barely thought to contact her himself. "Thanks, Mom. I should probably call her later. She also mentioned that Margaret reached out to her asking about you." Elizabeth's tone remained carefully neutral, but Nathan detected the underlying tension. His mother had never hidden her dislike of his ex-wife. "Yeah, she emailed me," Nathan confirmed, the reminder triggering his earlier unease about the message. "Said she heard I was unwell from a mutual acquaintance. Seemed strange." Elizabeth's hands stilled in their organizing. "Strange how?" "We don't have mutual acquaintances anymore. We don't move in the same circles, don't share friends. And how would anyone know I'm in the hospital? I haven't exactly been posting updates on social media." His mother's expression shifted, concern deepening the lines around her eyes. "Have you responded?" "No," Nathan admitted. "Been a little preoccupied with the whole unknown parasites situation." Elizabeth nodded, her movements resuming with determined efficiency. "Probably for the best." That woman never brought anything but trouble. Nathan might have defended Margaret once, might have pointed out that the failure of their marriage wasn't entirely her fault. But recent events had shifted his perspective, making old arguments seem distant and irrelevant. Instead, he watched his mother arrange his meager possessions with the same care she'd shown throughout his childhood, creating order in the midst of chaos. The surgical team arrived just before evening. Visiting hours ended, explaining the procedure scheduled for the following morning. Dr. Carter would lead, assisted by a tropical disease specialist flown in from Johns Hopkins and a surgical team experienced in tissue excision. They'd remove the largest concentrations of parasites, paying particular attention to areas where the infestation appeared to be spreading toward deeper tissues. "We'll focus on preserving function and minimizing cosmetic impact," the surgical resident explained, his youth and earnestness somehow making the situation more surreal. "But our primary goal is containment." After they left, Elizabeth fussed with Nathan's blankets, adjusting them with nervous energy. "We'll be here when you wake up," she promised. "Your father's arranged for a chaplain to come by in the morning before the surgery." "I'm not religious, Mom," Nathan reminded her gently. "I know, dear, but a little prayer never hurt anyone, and your father finds it comforting." She leaned down to kiss his forehead, a gesture so maternal it made his throat tighten. "Try to rest now. Big day tomorrow." Left alone as visiting hours ended, Nathan found sleep elusive despite the sedatives added to his IV. The hospital quieted around him, footsteps in the corridor growing less frequent, voices at the nurses' station dropping to murmurs. In this liminal space between wakefulness and sleep, his mind wandered to strange territories. He thought of Janet's husband, returning from Central America with what seemed like innocent insect bites, unaware of the deadly passengers he carried within his skin. He thought of the elderly woman who had owned his bed frame, her collection of South American souvenirs, her unknown fate. Had she suffered as he was suffering? Had she understood what was happening to her? And he thought of Margaret, their marriage dissolving not in dramatic betrayal but in slow, insidious disconnection. She'd traveled often in those final months, business trips, she'd said, though her explanations grew vaguer as their relationship deteriorated. South America had been one of her destinations. The timing nudged at his consciousness, a puzzle piece that didn't quite fit yet couldn't be discarded. The night nurse's rounds interrupted these unsettling reflections. She checked his vitals, adjusted his medication, and offered a sympathetic smile before dimming the lights again. Nathan drifted finally toward sleep, his dreams fragmented and disturbing. Creatures moving beneath the surface of still waters, shadows lengthening across familiar rooms. Margaret's face transforming into something unrecognizable as she handed him a gift wrapped in tissue paper. He woke with a start to early morning light and the sound of someone entering his room. Janet Parker approached his bed, already dressed in surgical scrubs, her expression professionally composed. "Pre-op will be here soon to take you down," she explained, checking his IV lines and vital signs. "How are you feeling?" "Scared," Nathan admitted, the word escaping before he could consider it. "What if this doesn't work? What if they're too widespread already?" Janet's movements paused, her eyes meeting his directly. "Then we try something else." Medicine is often a process of elimination, Nathan. Each attempt gives us more information, brings us closer to a solution. Is that what happened with your husband? A process of elimination that ran out of options? The question was unfair, and Nathan regretted it immediately. Janet's expression flickered briefly before settling into practiced neutrality. Every case is different. My husband's infection wasn't identified until it had reached critical systems. Yours was caught earlier. I'm sorry, Nathan said. That was out of line. Janet adjusted his blanket unnecessarily, a small gesture that seemed almost maternal. Fear makes us say things we wouldn't otherwise. I understand. She straightened, professionalism reasserting itself. Dr. Lewis asked me to tell you they visited your apartment yesterday. They've taken the bed frame and several other items for testing. Did they find anything? Nathan asked, suddenly alert despite the sedative still in his system. Preliminary inspection confirmed the presence of parasitic eggs in the wood of the bed frame, particularly in the carvings. Janet's voice remained clinical, but her eyes conveyed the significance. They're still analyzing to determine if it matches the species infecting you, but it seems likely. The confirmation of his suspicions brought little satisfaction. And my neighbor, Frank, did they speak with him? Something shifted in Janet's expression. Concern, perhaps, or caution. I believe they made contact, yes. Dr. Lewis will update you after your procedure. Before Nathan could press for details, the pre-op team arrived to transport him to surgery. The next hour passed in a blur of procedural efficiency, transfer to a gurney, movement through corridors, the cold brightness of the surgical preparation area. His parents were allowed a brief visit before anesthesia, his mother's eyes red-rimmed but determined, his father's hand strong and steady on his shoulder. "See you on the other side, son," William Walsh said, the military phraseology carrying unexpected emotional weight. The anesthesiologist explained the procedure as she worked, her voice a soothing counterpoint to the clinical activity around her. You'll feel a slight burning as the medication enters your IV, then drowsiness. When you wake up, you'll be in recovery. Nathan nodded, watching the clear liquid push through his line. As consciousness began to fade, his last thought was of the bed frame, its intricate carvings, the dark wood burnished by years of touch, the unseen passengers it had carried into his life and beneath his skin. Darkness claimed him, and Nathan Walsh surrendered to its momentary mercy. Consciousness returned in fragments, the antiseptic smell of the recovery room, the steady beeping of monitoring equipment, the murmur of medical staff. Nathan tried to open his eyes, but his lids felt weighted, refusing to cooperate. His body seemed distant, disconnected, a landscape of dull pain held at bay by medication. "He's coming around," a voice observed clinically. "BP's stable, temps 99.2. Nathan tried again to open his eyes, succeeding this time in a narrow squint against the harsh fluorescent lighting. A nurse he didn't recognize leaned over him, checking the readouts on a nearby monitor. "Welcome back, Mr. Walsh," she said, noticing his wakeful state. "Surgery went well. Dr. Carter will be by shortly to explain everything." Nathan attempted to speak, but his throat felt raw from the intubation tube, his mouth cotton dry. The nurse offered ice chips, placing one carefully between his lips. The cool moisture was heavenly, a small mercy in a body that felt profoundly altered. As awareness gradually sharpened, Nathan became conscious of the extensive bandaging across his torso and left shoulder. Even through the haze of painkillers, he could feel the pull of surgical adhesives, the pressure of gauze packing, the strange absence of the burning itch that had tormented him for weeks. Whether this represented improvement or merely the overwhelming impact of surgery remained unclear. Dr. Carter arrived as Nathan was being transferred from recovery to a private room in the ICU, an upgrade in care that might have been reassuring under different circumstances. The infectious disease specialist looked fatigued but satisfied, the expression of a man who had faced a formidable challenge and held his ground. "The procedure went as well as we could have hoped," Dr. Carter explained once Nathan was settled. We removed 7 major sites of infestation, focusing on areas where the parasites had clustered most densely. "Did you get them all?" Nathan asked, his voice a raspy whisper. Dr. Carter's slight hesitation contained volumes. "We excised all the visible mature colonies. The combined approach, surgical removal plus the enhanced medication protocol, gives us our best chance at complete eradication." Not quite the definitive victory Nathan had hoped for. "What did they look like?" he asked, needing to visualize the enemy despite the certain horror of the answer. The mature specimens were approximately 2 to 3 centimeters in length, with a segmented body structure typical of nematodes, Dr. Carter replied, his clinical description deliberately stripped of emotional content. "Dr. Lewis has them now for comprehensive analysis. The tissue samples have been sent to multiple laboratories for confirmation of species identification." Before Nathan could ask further questions, his parents entered the room, their faces lighting with relief at seeing him conscious. His mother rushed to his bedside, her hands fluttering nervously before settling gently on his unbandaged arm. "Oh, thank God," Elizabeth breathed, eyes glistening. "The waiting was terrible. They told us it took longer than expected. We encountered more extensive infiltration than the imaging suggested," Dr. Carter explained, shifting seamlessly to addressing the family. "Some of the parasites had established in the fascial layers, the connective tissue between muscle groups. Those required more delicate extraction." William Walsh stood at the foot of the bed, his military posture at odds with the emotion evident in his eyes. "Bottom line, doctor, is my son going to recover?" Dr. Carter met the older man's gaze directly. "Mr. Walsh is receiving the most aggressive treatment available for this type of infestation. The next 48 hours will be critical as we monitor for signs of resurgence or systemic spread. I'm cautiously optimistic, but I won't mislead you. We're in uncharted territory with this particular variant." After the doctor left, Nathan's parents maintained a quiet vigil beside his bed. His mother fussed with his blankets and offered sips of water while his father stood sentry-like by the window, his back to the room as he stared out at the hospital grounds. The unnatural stillness in the normally active man spoke volumes about his concern. "Dad," Nathan called softly, the effort of speaking still considerable. "You should sit down. Both of you should rest. I'm not going anywhere." William turned, a ghost of a smile touching his lips. "Giving orders now, son?" "Learning from the best," Nathan replied, the familiar banter feeling like a tenuous connection to normality. His father crossed to the bedside chair and lowered himself stiffly, the movement betraying his age despite his efforts to conceal it. "Your mother and I have been talking," he said, exchanging glances with Elizabeth. "When you're discharged, you'll come home with us. No arguments." Under different circumstances, Nathan might have resisted, might have insisted on his independence. Now, the thought of returning to his apartment, to the place where this nightmare began, filled him with visceral dread. "Okay," he agreed simply. Surprise flickered across his father's face, quickly replaced by satisfaction. "Good. Your mother's already making plans to set up the guest room." "It's all ready," Elizabeth confirmed, patting Nathan's hand. "I called Mrs. Abernathy next door to dust and air it out. And I've got a list of specialists in Hartford we can consult for follow-up care." The casual mention of their preparations, the assumption that he would need ongoing care, underscored the severity of his condition more powerfully than any medical briefing. Nathan closed his eyes briefly, overwhelmed by the realization that his life had fundamentally changed. Whatever happened next, recovery or continued struggle, nothing would return to what it had been. "Thank you," he managed, the simple acknowledgement encompassing far more than the immediate offer of a place to recuperate. The afternoon passed in a haze of pain medication, vitals checks, and brief periods of fitful sleep. Nathan drifted in and out of consciousness, vaguely aware of his parents' quiet conversations, the shift change of nursing staff, the gradually diminishing daylight through the ICU window. Each time he woke, the pain seemed to have shifted, moving from sharp and localized to a deeper, more diffuse ache that radiated through his torso. During one such wakeful period, he found Janet Parker checking his IV lines, her movements efficient in the dimmed evening lighting. "How's the pain?" she asked, noting his alertness. "Changing," Nathan replied, struggling to articulate the sensation. "Less sharp, more spreading." Janet's hands stilled momentarily, her expression carefully neutral as she made a note in his chart. "I'll mention that to Dr. Carter. It might just be post-surgical inflammation, but we're monitoring everything closely." "Janet," Nathan said, gathering his strength to form the question that had nagged at him. "The team that went to my apartment, did they speak with my neighbor, with Frank?" A shadow crossed her face. "They did. Mr. Miller was helpful in providing context about your apartment building." "What kind of context?" Janet hesitated, glancing toward the door where Nathan's parents had stepped out momentarily to speak with a social worker about discharge planning. "He mentioned that the previous tenant in your unit had health issues before moving out. Skin problems, he called them. She relocated to assisted living about 6 months before you moved in." The implication settled like a stone in Nathan's stomach. "The apartment was infected before I moved in, and no one said anything?" "It's not that simple," Janet cautioned. "Mr. Miller's observations aren't a diagnosis. The previous tenant could have had any number of dermatological conditions. Dr. Lewis is investigating further, trying to locate her for follow-up." Before Nathan could press for more information, his parents returned, accompanied by Dr. Lewis. The CDC specialist looked tired but animated, the particular energy of someone on the verge of a significant discovery. "Mr. Walsh," she greeted him with professional warmth. "How are you feeling this evening?" "Like I've had chunks carved out of me," Nathan replied dryly. "But the itching's better." Dr. Lewis nodded, her expression suggesting this was expected. "I wanted to update you on our findings from your apartment. We've confirmed that the bed frame contained viable parasitic eggs, primarily concentrated in the raw wood of the undercarriage and in crevices of the decorative carvings." "So that was definitely the source?" Elizabeth asked, her hand finding Nathan's protectively. "One source," Dr. Lewis clarified. "We also found evidence of infestation in the wooden floorboards beneath your bed and in the structural beams of the wall behind your headboard. The preliminary genetic analysis matches the parasites removed during your surgery." The revelation sent a chill through Nathan despite the warm hospital blankets. The creatures hadn't just been in his bed frame, they'd been in the very structure of his apartment, surrounding him as he slept. "The building manager has been notified," Dr. Lewis continued. "Public health authorities are conducting an assessment of adjacent units. Your apartment itself has been quarantined pending complete remediation." "Quarantined?" Nathan echoed, the word carrying ominous weight. "Standard procedure for environmental containment of exotic parasites," Dr. Lewis explained. "Unfortunately, this means your personal belongings will likely need to be destroyed or undergo specialized decontamination depending on the material." The practical implications began to sink in. Nathan's clothes, books, electronics, the few mementos he'd kept after the divorce, all potentially harboring microscopic threats, all possibly lost. "We'll replace everything," his father said firmly, reading Nathan's expression. "Every last item." William Walsh had never been a wealthy man. A career military officer followed by years as a high school history teacher hadn't built substantial savings. But in that moment, his declaration carried absolute conviction. Nathan felt simultaneously grateful and guilty, a grown man once again dependent on his parents' support. Dr. Lewis cleared her throat gently. "There's one more thing you should know. We've made contact with the previous tenant of your unit, a Ms. Eleanor Winters. She's currently in a long-term care facility in New Hampshire." "Is she?" Nathan began, uncertain how to phrase the question. "She's alive," Dr. Lewis confirmed, understanding his concern, "but in poor health." She worked as an import coordinator for a home goods company specializing in South American artisanal products. According to her medical records, she began experiencing symptoms similar to yours approximately 8 months ago. Unfortunately, her doctors attributed the skin manifestations to allergic reactions and later to psychological factors. By the time she was referred to a specialist, she had developed neurological complications. The room fell silent as the implications settled over them. Nathan felt a cold dread spreading through him, a fear more profound than any he'd experienced during this ordeal. Neurological complications? Dr. Lewis's expression remained professionally composed, but her eyes conveyed genuine concern. Some parasitic species can migrate through tissue to reach the central nervous system. In Mrs. Winters' case, this resulted in cognitive impairment and partial paralysis. "But," she added quickly, seeing the horror on their faces, "we identified your infection much earlier, and the surgical intervention has removed the most established colonies before any neurological symptoms appeared." Elizabeth made a small, distressed sound, her fingers tightening around Nathan's. William Walsh stood straighter, as if physically bracing against this new threat. "What are her chances of recovery?" he asked, the question Nathan couldn't bring himself to voice. "Limited," Dr. Lewis admitted. "The damage to neural tissue is largely permanent. But we're using what we've learned from her case to ensure a different outcome for your son." After Dr. Lewis departed, promising further updates as lab results came in, a heavy silence fell over the ICU room. The steady beep of monitoring equipment seemed louder somehow, each tone a reminder of Nathan's tenuous position between crisis and recovery. "We should let you rest," Elizabeth said finally, her voice strained but determined. "We'll be right outside if you need anything." Nathan nodded, suddenly exhausted beyond words. As his parents moved toward the door, a thought struck him with unexpected clarity. "Mom," he called softly, "could you check something for me? In my phone?" Elizabeth returned to his bedside, retrieving his phone from the small cabinet where his personal effects were stored. "What do you need, dear?" "The email from Margaret," Nathan said, his voice stronger as a theory began forming in his mind. "When did she send it exactly?" His mother's expression tightened at the mention of his ex-wife, but she obediently unlocked the phone and navigated to his email. "Tuesday morning, 9:47 a.m. Tuesday morning, hours before he'd been admitted to the hospital, before anyone beyond Dr. Harrison and her staff knew about his condition. Yet Margaret had somehow heard he was unwell. The timing nagged at him, a discordant note in an already chaotic symphony. "Thanks, Mom," he said, taking the phone from her and placing it on his bedside table. "I just needed to check something." After his parents left, Nathan lay in the semi-darkness of the ICU, his mind racing despite his body's exhaustion. Eleanor Winters, the previous tenant, had worked with South American imports. Margaret had traveled to South America in the final months of their marriage. The bed frame had come from an estate sale after Ms. Winters moved out. Connections hovered just beyond his grasp, fragments that refused to form a coherent picture. Sleep claimed him eventually, but it was troubled, filled with disjointed dreams. Margaret handing him a package wrapped in strange, patterned paper. An old woman carving designs into dark wood, her fingers bleeding into the grain. His own skin becoming transparent, revealing writhing movement beneath. He woke suddenly, gasping to find Janet checking his vital signs in the pre-dawn dimness. Her expression shifted from professional assessment to concern as she noted his distress. "Bad dream?" she asked softly, adjusting his oxygen monitor. Something like that, Nathan managed, his heart rate gradually slowing. Janet, did they tell you about the previous tenant? About what happened to her? Janet's movements slowed, her focus seemingly absorbed in straightening his blankets. Yes, she admitted finally. Her case has similarities to my husband's. Different parasite, similar progression. They said she has neurological damage, Nathan pressed, needing to hear the truth from someone who wouldn't soften it with clinical terminology or false reassurance. That it's permanent. Janet met his gaze directly, her professional detachment giving way to genuine compassion. Some types of parasitic infection can cause irreversible damage if they reach the central nervous system. That's why the aggressive treatment approach in your case, to prevent that possibility. But it could still happen, Nathan said, not a question but a statement of understanding. Even with the surgery, even with the medications, these things could still be inside me, moving toward my brain or spine. It's a possibility we're working to prevent, Janet acknowledged, her honesty somehow more comforting than platitudes would have been. The next round of blood work and imaging will tell us more about how effective the combined approach has been. Nathan nodded, appreciating her directness. One more question, he said, gathering his courage. Your husband, how long did he have? From when they finally understood what was happening to when he— 6 weeks, Janet interrupted, the words clipped with old pain. But his case was different. The parasite was already established in his cerebrospinal fluid when they identified it. You're nowhere near that stage. She squeezed his hand briefly, a gesture that transcended the professional boundaries she typically maintained. Try to rest. The more your body can focus on healing, the better your chances. As Janet left, the first gray light of dawn began filtering through the window blinds, casting long shadows across the ICU room. Nathan lay motionless, contemplating what he'd learned. 6 weeks from diagnosis to death. Eleanor Winters, alive but permanently damaged. His own future. A question mark hanging in the sterile hospital air. Outside his room, the hospital was waking up. Shift changes, breakfast carts, the steady rhythm of an institution dedicated to the knife-edge balance between life and death. Nathan closed his eyes, not to sleep but to retreat inward, gathering whatever strength remained for the battle still ahead. Because despite the surgery, despite the medications flowing into his veins, despite the hovering presence of specialists and concerned parents, Nathan knew with inexplicable certainty that this ordeal was far from over. Something fundamental had been altered, not just his body, invaded and partially excised, but his understanding of his place in the world. The illusion of safety, of control, had been irreparably shattered. And somewhere beneath his bandages, beneath his skin, the unseen enemy waited. 3 days after surgery, Nathan was moved from the ICU to a private room on the infectious disease ward. The transition marked cautious progress. His vital signs had stabilized. The surgical sites showed no signs of infection, and the latest blood work indicated a slight decrease in inflammatory markers. Yet beneath these positive indicators lurked uncertainty. The advanced imaging scheduled for the following day would reveal whether the parasites had truly been contained or were continuing their insidious spread through his tissues. His new room felt almost luxurious after the clinical intensity of the ICU. A window with an actual view of the hospital gardens, a small seating area where his parents could rest more comfortably during their visits, even a television mounted on the wall opposite his bed. These small comforts seemed to exist in a different universe from the reality of his condition, a pretense of normalcy that Nathan found both comforting and absurd. Doctor Carter visited each morning, his examinations thorough, but his explanations increasingly guarded. The infectious disease specialist had developed a habit of slight hesitation before answering questions, a barely perceptible pause that Nathan had come to recognize as the boundary between complete honesty and therapeutic optimism. "The combination therapy appears to be having some effect," Dr. Carter reported during his morning rounds reviewing the latest test results. "Your eosinophil count has decreased 15% since surgery, which suggests reduced parasitic activity." "But not elimination," Nathan noted, becoming fluent in the nuances of medical equivocation. Dr. Carter's slight pause confirmed Nathan's interpretation. "Complete elimination typically takes time, even with optimal treatment. We're seeing positive indicators, but we need to maintain the aggressive approach." After the doctor left, William Walsh emerged from the small bathroom where he'd been washing up, having spent the night in the reclining chair beside Nathan's bed. At 78, the overnight vigil had left visible marks, deeper lines around his eyes, a slight stiffness in his movements, but he refused all suggestions that he return to the hotel for proper rest. "Your mother's bringing breakfast," he announced, settling into the chair with a newspaper he'd barely glance at. "Real food, not this hospital stuff. She's got Mrs. Abernathy sending her recipes for protein shakes. Says you need to build your strength." Nathan nodded, touched by the familiar pattern of his mother's caretaking even as he recognized it as deflection, a way of maintaining control in an uncontrollable situation. "Dad, you should get some actual sleep. In a bed." "I'm stable now." William folded the newspaper with deliberate precision. "I'll sleep when we're home, all of us." His tone brooked no argument, the same voice that had ended countless childhood debates. A knock at the door interrupted the brewing disagreement. Janet Parker entered, accompanied by Dr. Lewis from the CDC. The infectious disease specialist carried a tablet computer and wore an expression that Nathan had learned to recognize, the carefully neutral look of someone bearing complicated news. "Mr. Walsh," Dr. Lewis greeted him, nodding acknowledgement to William. "How are you feeling this morning?" "Better than yesterday," Nathan replied, the standard patient response that revealed nothing. Dr. Lewis pulled up a chair, her posture suggesting this wouldn't be a brief visit. "I wanted to update you on our findings regarding the source of your infection. We've completed genetic analysis of the parasites removed during your surgery and compared them to samples collected from your apartment and from Ms. Winter's medical records." She turned her tablet to show a complex chart with highlighted sections. "The parasites infecting you and Miss Winters share distinctive genetic markers, confirming they're the same species, a previously undocumented variant of Dirofilaria that appears to have adapted to human hosts more aggressively than known strains." "So I definitely got this from the apartment, from her leftover furniture?" Nathan asked, seeking confirmation of what seemed obvious. Dr. Lewis's expression shifted subtly. "That was our initial assumption. However, the timeline presents some inconsistencies. Miss Winters vacated the apartment over 6 months before you moved in, and these parasites typically can't survive that long without a host. Additionally, the building management confirms they had the apartment professionally cleaned and treated for pests between tenants." William leaned forward, his attention sharpened. "What are you saying, Doctor?" "We believe there may have been a more recent introduction of the parasite," Dr. Lewis explained carefully, "possibly through an item brought into the apartment after you moved in." Nathan felt a chill that had nothing to do with hospital air conditioning. "The bed frame from the estate sale." "That's one possibility," Dr. Lewis acknowledged. "Though our examination shows the infestation in the frame was relatively recent, weeks rather than months. This suggests it might have been contaminated after it was in your possession, rather than carrying the parasites from its original source." The implications swirled in Nathan's mind, pieces of a puzzle rearranging themselves. "So something, or someone, introduced these parasites into my apartment recently, Doctor?" Lewis maintained her professional composure, but her eyes reflected the seriousness of the situation. We're exploring all possibilities. In cases of rare parasitic infection, establishing the transmission vector is crucial for both treatment and prevention. Janet, who had remained silent during this exchange, spoke up. Dr. Lewis, perhaps now would be a good time to discuss the other connection we've discovered? The CDC specialist nodded, tapping her tablet to bring up a new document. Mr. Walsh, in our investigation, we've been tracking other cases with similar parasitological profiles. There's a case from approximately 14 months ago that shares striking similarities with yours and Miss Winters. Janet's husband, Nathan said quietly, the connection crystallizing in his mind. Dr. Lewis glanced at the nurse with surprise. Yes. Thomas Parker contracted a nearly identical parasitic infection following a professional photography assignment in Ecuador. The progression and presentation were remarkably similar, though his infection was unfortunately at an advanced stage when identified. William Walsh's expression darkened. Are you suggesting some kind of outbreak? Should the public be warned? We're not seeing evidence of a widespread problem, Dr. Lewis assured him. These cases appear to be isolated incidents with specific exposure patterns. What's notable is the connection between them. What connection? Nathan asked, though a suspicion had already begun forming in his mind. Dr. Lewis hesitated, exchanging glances with Janet. Miss Winters worked for a company called Global Artisan Imports, specializing in South American decorative items. Thomas Parker photographed artisanal crafts in Ecuador for several magazines and catalogs, and according to your employment records, your ex-wife Margaret Walsh worked as a marketing consultant for Global Artisan Imports, Nathan finished, the final piece clicking into place. She started there about a year before our divorce. She traveled to South America several times for work. The room fell silent as the implications settled over them. William Walsh's face had gone rigid, his hands gripping the arms of his chair with whitened knuckles. Nathan, he said finally, his voice dangerously quiet, when exactly did Margaret contact you about your illness? Tuesday morning, Nathan replied, the significance of the timing now glaringly obvious. Before I was admitted to the hospital, before anyone beyond my dermatologist knew something was seriously wrong. Janet stepped closer to the bed, her professional demeanor giving way to visible concern. The email. What exactly did she say? Nathan reached for his phone on the bedside table, navigating to the message with trembling fingers. He read it aloud, the innocuous words now carrying sinister weight. Nathan, a mutual acquaintance mentioned you're having health issues. I know we didn't part on the best terms, but I wanted to reach out. If there's anything you need, please don't hesitate to ask. Take care, Margaret. A mutual acquaintance, William repeated, his military bearing now radiating barely contained fury. When no one knew you were sick. Dr. Lewis took the phone gently from Nathan's hand, her expression grave. Mr. Walsh, with your permission, I'd like to forward this email to our investigation team. The timing suggests Margaret Walsh may have knowledge about your condition that warrants further inquiry. Nathan nodded numbly, the implications still unfolding in his mind. Could Margaret have deliberately exposed him to these parasites? The woman he had married, lived with, loved, could she have orchestrated this living nightmare as some form of elaborate revenge for their failed relationship? The bed frame, he said suddenly, the memory surfacing with new significance. She helped me move it into the apartment. Said she was being mature about the divorce by helping me get settled. She insisted on positioning it herself. Said the feng shui needed to be right. He laughed hollowly at the memory. I thought she was trying to be friends. William Walsh stood abruptly, pacing the small room with barely contained energy. This is criminal, he declared, the former military officer evident in his bearing. If she deliberately infected my son, that's attempted murder. Dad, Nathan cautioned, still struggling to reconcile the Margaret he had known with this horrifying possibility. We don't know for certain. 3 cases, Janet interrupted quietly. All connected to the same company, all with similar patterns of infection. That's not coincidence. Dr. Lewis raised a hand, her professional training asserting itself amid the rising emotions. We need to proceed carefully here. These connections warrant thorough investigation, but we shouldn't jump to conclusions. There could be environmental factors at the company, unintentional exposure patterns, or other explanations. Or my ex-wife could be a psychopath who decided to let parasites eat me from the inside out because I got the better lawyer in our divorce, Nathan countered, a hysterical edge creeping into his voice. The tension was broken by Elizabeth Walsh's arrival, carrying an insulated bag containing homemade food. She stopped in the doorway, immediately sensing the charged atmosphere. "What's happened? Is Nathan all right?" William crossed to his wife, placing a protective arm around her shoulders. "Elizabeth, we need to talk to the police. That woman, Margaret, she may have deliberately made Nathan sick." Elizabeth's face drained of color, her grip on the food bag tightening until her knuckles whitened. "I knew it," she whispered, years of maternal suspicion validated in the worst possible way. "I always knew there was something wrong with her." "Doctor." Lewis intervened before the situation could escalate further. "Mrs. Walsh, we're still gathering information. Let's not get ahead of the evidence." She turned to Nathan, her expression softening slightly. "Mr. Walsh, I understand this is deeply disturbing, but right now, our primary focus needs to remain on your treatment and recovery. The investigation will proceed in parallel." Nathan nodded, suddenly exhausted beyond words. The physical toll of the parasitic infection and surgery paled in comparison to the emotional impact of this revelation. If true, it meant the person who had once shared his bed, his name, his life, had calculated his suffering with cold precision. The betrayal transcended even the biological invasion of the parasites. "I need to rest," he said finally, closing his eyes against the concerned faces surrounding him. "Please, I need some time." The room gradually emptied. Doctor. Lewis departing with a promise to return later, his parents reluctantly agreeing to get lunch in the cafeteria, Janet adjusting his IV medications to include a mild sedative. Left alone, Nathan stared at the ceiling, tracing the fine cracks in the hospital paint as his mind worked through the implications. He remembered Margaret's face when they'd signed the divorce papers, the flash of something cold beneath her practiced smile. He recalled her insistence on handling certain aspects of their separation herself, the small comments that had seemed merely bitter at the time but now carried potential malice. Most of all, he remembered her final words to him. "You'll get exactly what you deserve, Nathan," delivered with a calm certainty that had haunted him. The sedative began to take effect, drawing him toward unwelcome sleep. As consciousness faded, Nathan's last coherent thought was not of revenge or justice, but of simple bewilderment. How was it possible to share years of your life with someone and never truly know them at all? When he woke hours later, the room had darkened with evening shadows. Janet stood by his bed, adjusting the blinds to block the setting sun from his face. She moved with quiet efficiency, her presence somehow comforting in its constancy. "How long was I out?" Nathan asked, his voice rough with sleep. "About 4 hours," Janet replied. "Your parents went back to the hotel to shower and change. They'll be back soon." She hesitated, then added, "There have been some developments while you were asleep." Nathan struggled to a more upright position, wincing as the movement pulled at his surgical sites. "What kind of developments?" Dr. Lewis contacted Global Artisan Imports. They confirmed Margaret Walsh still works there as their marketing director. They also confirmed she recently returned from a business trip to Ecuador. She arrived back in the country the day before she sent you that email. The confirmation landed like a physical blow. "And the police?" "Dr. Lewis has been in contact with them. They're reviewing the evidence, but Janet paused, choosing her words carefully. Proving intentional transmission of a parasitic organism is legally complex. They're proceeding cautiously. Of course they are, Nathan said bitterly. What's she going to say? Yes, officer, I deliberately infected my ex-husband with exotic parasites as revenge for our divorce. There's reasonable doubt built right in. Janet adjusted his IV line, her movements deliberate. The investigation is ongoing. And there's something else you should know. She met his gaze directly. I've been in contact with Eleanor Winter's family. When they learned about the connection to global artisan imports, they mentioned that Mrs. Winters had been in a relationship with someone from the company's executive team. It ended badly shortly before she began experiencing symptoms. Let me guess, Nathan said, the pattern now unmistakable. Margaret was involved somehow. Janet nodded. According to the family, Margaret was the one who introduced them. She arranged their first meeting, encouraged the relationship. A chill swept through Nathan that had nothing to do with his medical condition. The picture forming was of something more calculated, more systemic than a single act of revenge. And your husband? Was there a connection there, too? Pain flickered across Janet's face. Thomas did a photo shoot for their catalog. Margaret was the marketing liaison who hired him. She specifically requested him for an extended assignment in Ecuador, even though his specialty was wildlife photography, not commercial work. The implications were staggering, not a single act of vengeance, but a pattern, a series of calculated exposures orchestrated with chilling precision. She's been doing this deliberately, Nathan whispered, the horror of it almost beyond comprehension, using these parasites as some kind of weapon. Janet's professional composure slipped, revealing the raw grief that clearly still lived just beneath the surface. That's what the evidence suggests. But proving it, legally, that's another matter entirely. Before Nathan could respond, his phone chimed with an incoming email. He glanced at it reflexively, then froze as he saw the sender, Margaret Walsh. With trembling fingers, he opened the message. Nathan, I heard you're in the hospital. Sounds serious. I hope they figure out what's wrong soon. These tropical parasites can be so unpredictable in how they progress. Some people recover completely, others experience lasting effects. It really comes down to timing and treatment. Funny how life works out, isn't it? Some people get exactly what they deserve, while others suffer unfairly. I've been thinking a lot about fairness lately. Wishing you a full recovery, Margaret. Nathan stared at the screen, the words seeming to pulse with malevolent intent. Not quite a confession, nothing that could be definitively proven as foreknowledge or admission, yet the message was unmistakable in its thinly veiled threat and acknowledgement. She knows, he said, handing the phone to Janet. She's practically admitting it, but in a way that gives her plausible deniability. Janet read the email, her expression hardening. This needs to go to Dr. Lewis and the police immediately. The specificity about tropical parasites when that information hasn't been made public, that's significant. As Janet stepped into the hallway to make the necessary calls, Nathan sank back against his pillows, a complex mixture of emotions washing over him. Horror at the calculated nature of what had been done to him, anger at the woman who had orchestrated his suffering, fear for what might still lie ahead, both medically and legally. But beneath these immediate reactions stirred something unexpected, a profound sense of clarity. The fog of uncertainty that had surrounded his illness from the beginning had finally lifted. He knew now what he was fighting and why. The enemy had a name, a face, a motive. And in that knowledge, despite the horror of the revelation, Nathan found a strange, grim determination taking root. Margaret had intended this as his end, a slow, agonizing dissolution from within. Instead, it would become his beginning. Whatever happened next, Whether justice was served or denied, whether his recovery was complete or partial, Nathan Walsh would no longer be defined by what was done to him, but by how he responded to it. When his parents returned an hour later, they found him sitting up in bed, making notes on a hospital pad. The sedative haze had cleared from his eyes, replaced by focused intensity. "Nathan?" his mother asked cautiously, sensing the change in him. "What are you doing?" "Making plans," he replied simply. "For after." William Walsh studied his son's face, recognition dawning in his eyes, the look of a soldier who has assessed the battlefield and determined his course of action. "After what, son?" Nathan met his father's gaze directly. "After I survive this. After we make sure Margaret can't do this to anyone else. After we find a way to help Eleanor Winters and honor Janet's husband. After all of it." For the first time since this ordeal began, William Walsh smiled. Not the worried, encouraging smile of a concerned parent, but the proud acknowledgement of one fighter recognizing another. "That's my boy," he said quietly, taking his place in the chair beside the bed. "Now, let's hear these plans of yours." 1 year later, Nathan Walsh stood at the podium in the conference room of the Parasitic Disease Research Foundation, the organization he had established with the settlement money from his lawsuit against Global Artisan Imports. The audience before him represented a cross-section of the medical community: infectious disease specialists, parasitologists, public health officials, and front-line medical practitioners who might be the first to encounter unusual parasitic infections. "Early recognition saves lives," Nathan concluded, his voice steady despite the emotion underlying his words. "If my dermatologist had dismissed my symptoms as merely stress-related or psychosomatic, as happened with Eleanor Winters, I wouldn't be standing here today." The Walsh-Parker Identification Protocol we're introducing today will help physicians recognize the warning signs of exotic parasitic infections before they reach critical stages. The protocol, named in honor of both Nathan and Thomas Parker, had been developed over the past year in collaboration with Dr. Carter, Dr. Lewis, and a team of specialists who had studied the 3 connected cases in exhaustive detail. It represented a significant advance in early detection methodology, particularly for parasites not commonly seen in North American medical practice. As Nathan stepped away from the podium to applause, he caught Janet Parker's eye in the front row. She offered a small, knowing smile, the expression of someone who understood both his triumph and the ongoing cost of that victory. Beside her sat his parents, Elizabeth beaming with undisguised pride, William maintaining his customary reserve but with unmistakable satisfaction in his eyes. The scars beneath Nathan's clothing had healed into pale ridges across his torso and shoulder, visible reminders of the battle fought within his body. The internal scars, the lasting damage to certain nerve pathways, the occasional phantom sensations, the blood tests he would need for the rest of his life to monitor for recurrence, remained invisible but ever present. Dr. Carter had been honest in his prognosis. Nathan had escaped the severe neurological complications that had devastated Eleanor Winters, but he would never be entirely free of the experience's physical legacy. After the presentation, as attendees mingled during the reception, Nathan found himself approached by a slender woman in her 30s, her professional attire contrasting with her hesitant demeanor. "Mr. Walsh, I'm Rebecca Chen. I worked with you at Meridian Software. I don't know if you remember me." "Rebecca, of course I remember you," Nathan replied warmly, genuinely pleased to see his former colleague. "You kept my job from imploding while I was sick. I never properly thanked you for that." She waved away his gratitude with an embarrassed gesture. "Anyone would have done the same. I wanted to tell you how amazing this is, what you're doing with the foundation, and to apologize." "Apologize? For what?" Rebecca glanced down, discomfort evident in her posture. for not realizing something was seriously wrong sooner, for suggesting it was just bed bugs. Maybe if I'd pushed you to see a doctor earlier. Hey, Nathan interrupted gently, you have nothing to apologize for. You were the only one at work who showed any concern at all. I'm the one who delayed seeking proper medical help. Rebecca nodded, though she seemed only partially convinced. Well, I'm glad you're doing better. I'm glad. The team misses you, though Anderson's been insufferable since they promoted him to your old position. Nathan laughed, the sound surprisingly natural after a year when laughter had been scarce. That sounds about right. How about you? Still fighting with the database architecture? As they chatted about the mundane details of the workplace he had left behind, Nathan felt a curious detachment, as though discussing a previous life lived by someone else. In many ways, that perception was accurate. Nathan Walsh, software developer with an unremarkable existence, had ceased to exist the moment Dr. Harrison had cut open that first bump and discovered what lurked beneath. Across the room, he spotted Dr. Lewis deep in conversation with the director of the CDC's Parasitic Diseases branch. The past year had brought significant professional recognition for the specialist, her work on the Walsh case establishing her as a leading authority on emerging parasitic threats. She had been a steadfast ally throughout Nathan's recovery and the subsequent legal proceedings, her testimony providing crucial scientific validation for what might otherwise have seemed an implausible accusation. The legal case against Margaret had been complex and contentious, exactly as Janet had predicted. Proving intentional transmission of a parasitic organism presented unprecedented challenges for the prosecution. Margaret had maintained her innocence throughout, her attorneys suggesting various alternative explanations: environmental exposure, coincidental timing, Nathan's own international travels years earlier. In the end, it wasn't the parasitology evidence that proved most damaging to Margaret's defense, but the digital trail she had left behind. Emails recovered from her work account revealed detailed research into Dirifilaria species and their life cycles. Her credit card records showed purchases of specialized entomological equipment and preservative chemicals. Most damning was the discovery on her home computer of a carefully maintained spreadsheet tracking the symptoms and progression of all three victims: Nathan, Eleanor Winters, and Thomas Parker, with clinical precision. Even then, the criminal case had ended in a plea agreement rather than a trial verdict. Margaret accepted guilt for aggravated assault and criminal negligence causing bodily harm, avoiding the more serious attempted murder charges in exchange for providing detailed information about her methods and motives. The 10-year sentence, likely to be reduced with good behavior, felt inadequate to many who knew the full extent of her actions, but the precedent established by the case would make future prosecutions of similar crimes more straightforward. The civil lawsuit against Global Artisan Imports had proven more straightforward. The company's negligence in monitoring the biological safety of their imported goods, combined with evidence that several executives had ignored warnings about potential contamination, led to a substantial settlement shared among the victims and their families. Nathan had immediately committed his portion to establishing the foundation, determined to create something meaningful from his suffering. Nathan. His father's voice drew him from his reflections. William Walsh approached with careful steps, his gait betraying the hip replacement surgery he had undergone 3 months earlier. The director wants to discuss expanding the educational program to medical schools. Thought you'd want to be part of that conversation. Nathan excused himself from Rebecca and followed his father across the reception hall. The past year had transformed their relationship in ways neither could have anticipated. The walls of pride and resentment that had separated them for years had crumbled in the face of shared crisis. William had become Nathan's fiercest advocate during his recovery, channeling his military discipline into managing the complex medical regimen and later into organizing the foundation's structural development. "How are you holding up?" William asked quietly as they walked. "You've been on your feet for hours." "I'm good," Nathan assured him, touched by the concern. "A little tired, but nothing like before." His father nodded, understanding the unspoken comparison. The first 6 months of recovery had been grueling, periods of progress interrupted by setbacks, promising treatments undermined by unexpected side effects, the constant vigilance for signs of resurgence. Through it all, his parents had remained steadfast, converting their guest room into a long-term recovery space, adapting their retirement routine to accommodate his needs. Moving back to his childhood home at 42 should have felt like regression, like failure. Instead, it had become an unexpected gift, a chance to rebuild not just his health, but the family bonds that had frayed over years of stubbornness and misunderstanding. The formal program concluded, Nathan found himself drawn to the small memorial display at the back of the reception hall. A professionally designed poster detailed Thomas Parker's photography career, featuring several of his stunning wildlife images alongside a dignified portrait. Beside it stood a similar tribute to Eleanor Winters, who had passed away 6 months earlier, her compromised system finally succumbing to pneumonia after 2 years of care facility residence. Janet stood before her husband's memorial, adjusting a slightly crooked frame with the careful touch of someone handling precious things. She had become an integral part of the Foundation's work, her nursing experience and personal connection to the case making her an invaluable advocate for patient education. "He would have been proud of this," Nathan said softly, coming to stand beside her, "of what you've accomplished in his name." Janet's smile held the complex mixture of grief and purpose that Nathan had come to recognize in her expressions. Thomas always said his photos should do something useful in the world. I think this qualifies. She turned to face him fully. "How about you? Holding up okay with all the attention today?" "Better than I expected," Nathan admitted. "Though I'll be glad when the formal part is over and we can get to the real work." The real work represented the Foundation's core mission. Not just education and awareness, but direct patient support for those suffering from rare parasitic infections. The program would provide financial assistance for specialized treatments, connect patients with experienced medical teams, and offer practical support during the often lengthy recovery process. It was the resource Nathan himself had desperately needed during his ordeal. Dr. Lewis mentioned they're making progress on the prophylactic treatment protocol, Janet noted, referring to the preventative medication regimen being developed for those who might be exposed to similar parasites through work or travel. The preliminary trials are showing good results. "That's something at least," Nathan replied, "making sure this doesn't happen to anyone else." As the reception began to wind down, Nathan found a moment of solitude on the small balcony adjoining the conference room. The autumn air carried a crisp edge, invigorating after hours in the climate-controlled environment. He leaned against the railing, gazing out at the city skyline as twilight settled over the buildings. A year ago, he had lain in a hospital bed, his body invaded by organisms that had nearly claimed his life, his future uncertain in every possible way. The journey since then, through surgery, treatment, rehabilitation, legal proceedings, and ultimately to this moment of purpose, had transformed him in ways he was still discovering. The door behind him opened, and his mother stepped onto the balcony, a shawl clutched around her shoulders against the evening chill. "There you are," Elizabeth said, coming to stand beside him. "Your father thought you might need a moment away from the crowd." Nathan smiled, touched by the understanding. "Just catching my breath. It's been a big day." Elizabeth studied his profile in the fading light, her expression softening with maternal perception. "You know, when you were a little boy, you used to get this same look on your face whenever you'd accomplish something difficult." "Part pride, part surprise, as if you couldn't quite believe you'd done it." Nathan chuckled. "I'm not sure I've accomplished anything yet. The Foundation is just getting started." "Nonsense," his mother countered with gentle firmness. You survived something that would have broken most people. You turned your suffering into purpose. And most impressive of all, her voice took on a teasing quality, you finally admitted your stubborn old parents might have something useful to contribute. Well, Dad does make a surprisingly good spreadsheet for a history teacher, Nathan conceded with a grin. Elizabeth laughed, the sound carrying on the evening air. He's been insufferable about his organizational skills since you put him in charge of the operations budget. Her expression grew more serious. We're proud of you, Nathan. Not just for today, but for every day of this past year. For your courage, your determination, for becoming the man we always knew you could be. The simple words, delivered without drama or excess, touched something deep within Nathan. His parents had never been effusive with praise, their generation more comfortable with stoic support than emotional declarations. This quiet acknowledgement meant more than any grand speech. I couldn't have done it without you and Dad, he said simply. I'm not sure I've ever really thanked you for that, for being there when I needed you most. Elizabeth patted his arm, the familiar gesture conveying decades of maternal love. That's what family does, dear. Though I must say your father and I rather hope your next project doesn't involve quite so many hospital visits. Nathan laughed, the sound genuine and unburdened. I'll do my best. As they returned to the reception, Nathan found himself surveying the room with a sense of quiet amazement. Dr. Carter, deep in conversation with a group of medical students, sharing insights gained from Nathan's case. Janet discussing patient advocacy with hospital administrators. His father reviewing organizational documents with the Foundation's newly hired executive director. All of these connections, this network of purpose, had emerged from what Margaret had intended as an act of pure destruction. The final guests departed as evening fully descended, leaving only the core group, Nathan, his parents, Janet, Dr. Carter, and Dr. Lewis, gathered in the now quiet conference room. Someone had opened a bottle of champagne, pouring modest amounts into plastic cups for an informal toast. To the Foundation, Dr. Carter proposed, raising his cup. And to the lives it will save. To Thomas and Eleanor, Janet added softly. May their experiences help others. William Walsh cleared his throat, unusually emotional. To my son, he said simply, meeting Nathan's eyes across the circle. Who showed us all what resilience truly means. As the toast concluded, Dr. Lewis approached Nathan with an expression that suggested unfinished business. Before we close out the evening, there's something you should know, she said, her voice low enough that only he could hear. We received confirmation today that the specialized containment facility housing the parasite samples from your case experienced a security breach last week. Nathan felt a cold sensation spreading through his chest. What kind of breach? Someone attempted to access the storage unit containing viable specimens, Dr. Lewis explained, her professional composure masking what must be significant concern. Security protocols prevented any removal, but the attempt itself is worrying. Margaret? Nathan asked, though he already suspected the answer. Dr. Lewis shook her head. She remains in custody, but we've identified unusual access patterns to her case files from outside the secure system. The FBI is investigating the possibility that she shared her methodology with others before her arrest. The implications settled over Nathan like a physical weight. The nightmare might not be over, might, in fact, be spreading beyond Margaret's original actions. The parasites that had nearly claimed his life could still pose a threat to others if her methods had been documented and shared. What do we do? He asked, instinctively including himself in whatever response might be necessary. Dr. Lewis studied him for a moment as if gauging his readiness for this new challenge. We remain vigilant. We accelerate the education program. We make sure medical professionals across the country can recognize these symptoms immediately. She paused, then added with quiet intensity, "And we find whoever tried to access those samples before they can use them." Nathan nodded, feeling an odd sense of clarity rather than fear. If this battle wasn't over, if Margaret's legacy threatened to extend beyond her direct actions, then the Foundation's work was even more vital than they had realized. The past couldn't be changed, but the future remained unwritten. "Then we'd better get to work," he said simply. As the small group gathered their belongings and prepared to depart, Nathan found himself lingering for a final moment in the conference room. The displays, the informational materials, the very existence of this foundation, all had emerged from darkness, pain, and malice, transformed through determination, knowledge, and compassion. Whatever challenges still lay ahead, Nathan Walsh was no longer defined by what had been done to him, but by what he had chosen to create in response. The parasites that had invaded his body had left their scars, but they had failed in their ultimate purpose. He had not been destroyed, but transformed, not diminished, but expanded. Elizabeth appeared at the door, her patience tinged with maternal concern. "Ready to go home, dear? You need your rest." Nathan smiled, switching off the conference room lights as he joined her. "Yes," he said simply. "I'm ready." Together they walked toward the waiting car, toward the future neither of them could have imagined a year before, a future built not despite tragedy, but because of how they had chosen to respond to it. In the quiet of the car as his father drove them home, Nathan watched the city lights pass by and felt, for perhaps the first time since this ordeal began, a sense of genuine peace. Not because the struggle was over, it might never truly be over, but because he had found purpose within it, meaning beyond it, and family beside him throughout. And in that knowledge there was healing far deeper than any medicine could provide. Life can turn on a dime, can't it, friends? Nathan Walsh's journey from mysterious, itchy bumps to fighting for his life reminds us that our greatest challenges often reveal our hidden strengths. Remember when our generation was taught to tough it out and handle problems alone? Nathan learned what we all eventually discover. True strength lies in accepting help, especially from family we may have pushed away. His reconciliation with his parents after years of stubborn silence resonates with many of us who've experienced similar rifts. The healing wasn't just physical. It was the mending of those precious family bonds that truly restored him. Through Nathan's story, we're reminded that it's never too late to rebuild relationships, to find purpose in our pain, and to create meaning that extends beyond our suffering. His foundation turned personal tragedy into hope for others. Isn't that what we all aspire to in our third act of life? Have you experienced a health crisis that unexpectedly brought your family closer together? Or perhaps you've found purpose through overcoming personal challenges. Share your story of resilience in the comments below. Your experience might be exactly what someone else needs to hear today.